Hi everyone, welcome to this Tools and Frontline Staff fortnightly session, which is here to bring everyone together to hear about practical ways in which you can help residents who are struggling with the cost of living or longer term poverty or other complex needs. Today we've got one presentation from Louis Miller, who's come along from Public Health to talk about the public health community vans. So I'm going to pass over to Louis and yeah, take it away. And thank you very much for coming.
Thank you. Hi everyone. I'm just going to share some slides. If I can.
It's just the button at the bottom of the screen.
Yeah, I'm just trying to find. There we are. Sorry, I'm being slow.
That's all right.
Right, here we are. Sorry about that. Thanks. Can you all see this?
Yeah, we can see it now. Yeah.
Great. Yeah, so nice to meet everyone. I'm Louis. I'm the operations manager in the City and Hackney Public Health team. Just gonna have a little chat about kind of who we are, how we came to be, the kind of work we're doing, and perhaps how we could sort of be relevant to anyone on this forum. So we're just a small team of 3 people as the core team, but as I'll go on to explain, we're kind of becoming a bit of a coalition of partners. We've got a van and a trailer that we used for primarily clinical interventions in the city and Hackney. A lot of our work is targeted to health inclusion groups, so that is people experiencing homelessness, just from a traveller community or any like marginalised group. But as our work has developed and is now a visual presence in Hackney, we're working more with the general population just as to support them where necessary. So I've been in Hackney since 2021, during the middle of the pandemic. We were helping with the pandemic response, delivering test kits and PPE to vulnerable residents. And as part of that, we also supported in the heat wave of 2022, delivering bottles of water to vulnerable residents in identified hotspots of areas of drinking. We also gave out sun cream and did general public health messaging of good practices. Then we sort of moved towards working with Turning Point, the recovery service, and doing outreach tours with them. And during this time, Public Health purchased a clinical van to use for vaccinations. But as time went on, the need for the clinical van waned, or the need for vaccinations waned. So we decided to, senior public health colleagues decided to continue purchasing the vehicle, but work with people experiencing homelessness and the local recovery service to try and reach individuals who are hardly reached and those people who don't engage with the traditional service, whether that be geographically or for all kinds of stigma reasons. In March of this year, we had some underspends. We rebranded that COVID trailer that you saw at the start, and we worked with the greenhouse to hire a nurse to do wound care and health checks to complement the offer we were given to the other services, which really helped us engage with a greater number of people and gave us a wider offering of support. But one thing that came up a lot of the time when we were out and about was the requests for housing advice and money advice. So we started to work with our colleagues from the housing department and also the Money Hub, and now we offer a weekly deployment at 2 locations. One is at the Narrowway, just opposite M&S, and one is at Ridley Road Market. These areas are identified through a multi-agency partnership meeting in which we discuss areas of concern. And what we're trying to do is try and engage as many people as possible and get them engaged with the services on board. So whether that is Turning Point, Swim, housing, or the Money Hub, or just anyone who walks past and fancies a chat. What we also have on the vehicle is a microwave and a fridge, and we provide hot drinks and food to anyone, and clothes that we get when we have donations from trade. And this has really been vital in extending the amount of time we spend with people, the conversations we have are longer. We were able to break down the barrier more, and we're just now quite a visible presence in Hackney. So whereas our initial starting point was working with those really marginalised substance users, now people just pop by. We have regular people who come and chat to us. We're a point of contact in which people who perhaps are lonely or just feeling a bit, we just get regulars who, it's small scale, like mental health interventions, just having a little chat and a cup of tea, and we get them visitors all the time. I think the way in which we can work, and hopefully we could work with people around this table, is we have a website which says where we're going to be at each time of the week and which partners are going to be involved. But also we do have food and clothes on board. So if someone just needs a warm space to sit and have a cup of coffee and chat to someone, and some meals to take away with them, then we can support people with that. As I said at the start, we are quite a small team, so we don't want to be flooding the service. So we have to be mindful of over-promising what we can support people with. But if anyone has a client or a service user or someone who they think might benefit from just come down the narrow way on a Friday between 12 and 5 and having a warm meal, then we're more than welcome to support them. We also work with other partners such as the Richmond Road vaccination team are going to be there on Friday. So there's other health needs that we try and also reach for residents as well as just being sort of a comforting and wraparound service that reduces the need for multiple appointments for individuals. We're still very much, I've been seeing we've had the van for a year, but it's only been 6 months really since we've started doing this multi-agency deployment. We don't pretend to know to say we've cracked it, and we're still learning what works in different groups, with different residents. What works for one cohort of people doesn't work for others. So when we start working with different community groups, we'll adapt our approach for them. But also we're quite keen to work with other partners as well. We've got a little coalition that we're starting to build up, but that's not to say that we want to stop there. Hopefully we can get more services on board to try and offer outreach to residents who don't usually engage with the services. I know it is getting into the winter months now, so it's going to be getting cold, but we're finding that we're getting great engagement with people who just don't go to the normal traditional services for whatever reason. So there you can see our little coffee espresso cappuccino machine, which goes on quite popularly. Our website shows where we're going to be each week, and it's updated, which changes each week, so it's worth checking out. But I was happy to take any questions that anyone might have.
Thanks, Louis. That's really, really good. Sounds like a really promising piece of work and a great offer as well for people on the call to get involved. Does anyone have any questions? I had a question, but does anyone else want to come in or me? Claire?
Yeah, I'm always first to talk. Hello, this is amazing. You said that the website tells you where you're going to be located each week. So does that mean you change locations each week, or you just in Mare Street and Dalston?
Well, so it changes a bit. So basically, Mare Street and Dalston are our main ones. But then, for example, we targeted Homerton Grove outside the hospital because there is a lot of patients for the mental health ward who are congregating on the bit of grass there in the summer. So we identified that as an area targeted there. So we do change, depends on the need and the season, but we are always at Malware and Dalston as a rule of thumb, but we do other engagements throughout the borough that do vary.
As I look from the other side of the borough, like the Clissold Park, Stamford Hill, Stoke Newton end, some clients that I've worked with wouldn't go down that area because the greenhouse and Turning Point are all in the same location, and then Mare Street and Dawson are pretty close to that location. So come to the other end of the borough.
No, glad you said that. We're working with Turning Point, but also other services to relocate to the north of the borough. Throughout the pandemic, I've got a lot of experience in my previous role. We were based in Stamford Hill, Finsbury Park, Woodbury Down quite a lot, so we know the area well, and we are keen to work in that area. And I know Turning Point want to do a satellite there because for that very reason, a lot of residents in that north of the borough don't like to come down. So you haven't been forgotten, and we're working towards finding the right location. So yeah, thanks for the encouragement. But yeah, we will.
But maybe we're at Stamford Hill, a surgery in Stamford Hill, so maybe we could set you up with a space to park there, or might be beneficial if you will share emails.
Yes, please do. Yeah, thank you.
Okay.
I was going to say on the back of that as well, 2 of the asylum hotels are up in the north of the borough as well, who I know really the people there really struggle with transport costs. So yeah, just another reason maybe why it's good. Yeah, it would be good to go up there as well. Penny, do you want to come in?
Yeah, hi. Yeah, it's brilliant what you do. What type of organisations are you hoping to get work with you?
That's a good question, really. I mean, we get a lot of requests for mental health support, but that is difficult on the van because often there's usually a formal process people need to go through before they can sort of get given support.
Mm-hmm.
I mean, key council services. So I mean, housing and money have gone down really well, and like any other sort of service that it just can break down a barrier for someone who has to have another appointment. I probably don't even know that is there.
Yeah.
In all honesty, I don't know quite what to mission, but like I'm very keen to learn what services are there and how you think you could fit in, or how we could sort of work together.
What's it like?
The reason I'm here today.
Yeah, and what's it like from your food supply? Do you have quite a lot already, or do you always run out?
We've got quite a lot. We've got quite a good supply. Yeah. The thing is, sometimes it varies, and you get things like turnips and just vegetables, which obviously are quite hard to give to someone on the back of a van. But when we get like things that are microwavable and can be eaten there and then they tend to go very quickly.
Because maybe we could look at with it being Ridley Road Market, if the times match up in the days, we could maybe look at agreeing some hot meals delivered, something like that, where you wouldn't have to use the microwave. Because we do Ridley Road Market as well. So yeah, we can have a chat further and we'll talk to the chef Ina and see if we can work something out and get some meals delivered to you what don't need microwaving. So we'll see. You said that you do. Sorry, when you did, you said, did you say anything about cleaning, like where they can have it get cleaned up or something?
No, I didn't say cleaning, but
would you consider that? Because we're actually looking at shower provision. You've got space for that?
We haven't on board. I do have aspirations for another vehicle, but at this stage, and all this, cleaning facilities and showers have been considered, but at this stage, the funds isn't secure, so it's not there. Yeah.
It's just that we've just managed to, so we've just actually secured a shower cubicle that can be put on the back of a van, and it's portable. So maybe we can have a chat.
That's good.
For that. Yeah. It might be something where we can team up together, and if you've got the space for it, then we can get people showers in Hackney. So, yeah.
Yeah, no.
We're saving that as an announcement, and we haven't worked out how we're going to do it. We just need the space now because we only got it last week. So, yeah. That would be good if we can team up with that.
That'd be great.
Yeah. I'll put my number in the chat anyway. So
great. No, thank you.
Brilliant. Thanks, guys. Jenny.
Yeah, I mean, that would be incredible, wouldn't it? And you could do a lot worse than to be collaborating with IDIAs and with Together Better in terms of your reach and the people you're working with. And because I was just thinking about, what you said, Louis, about, you know, the mental health support needs of people coming to the bus. And obviously, if you're only there for one day and then there's people in that area, I guess it would really make sense for maybe there's something we can do to support introductions between local organisations as well. You know, obviously we've met some here today, but there'll be quite a lot of others that Charlie and Hannah are out meeting quite a lot, and that we're aware of, and that we're funding through the Community Infrastructure Grants Project. I guess I'm thinking about, you know, MRS in Gillett Square, and while they're not delivering, you know, mental health interventions as such, they are there. You know, they're there all the time, and you know, there are. I guess there's something about the support that a lot of the organisations on this call and those that I'm talking about provide that does support people's mental health, whether it's through volunteering opportunities or through, you know, all the amazing, you know, engaging in activities and kind of moving people through, you know, from a beneficiary to playing an active role, and the support that provides with mental health. So yeah, I guess it'd be interesting to see what might come of some collaborations with some of our voluntary sector organisations who are probably more creative than most of us sometimes, and you know, with the combined kind of resources and ideas and problem solving together. I mean, I think there could be some really exciting things worth trying, and certainly our team would be really interested in supporting you all with that collaboration, however you think we can helpfully support. So let us know. I mean, I think your name came up the other day actually in a meeting around temporary accommodation residents in health outcomes, and so we might end up working on a piece of work in Woodbury Down area. I think colleagues are going to be calling a meeting with you and members of our team and Hannah. So hopefully that will give us an opportunity to do something potentially in the north, and you know, see if we bring in some of our relationships with them.
Definitely, that sounds good. I mean, we're definitely keen to work with voluntary organisations, because we found that, like, I mean, I don't know if you know Swim, I don't know if it's called Sport
Yes.
but like,
Yeah,
I know they're not working with them, and them having the ties to the community. It's just like, it's one thing I was rocking up and just like expect people to turn up. That's not going to be the case. We need to work with organisations who are trusted, and then now through their trust, we become trusted. And like to see the conversation that like my colleagues, particularly because they're out every day, hold with residents, and they just know their face. They come back every week, have a cup of tea. They know what their order is, and like. All started off from that community link that we work with from the organisation. So very keen to sort of work with different organisations and sort of try and reach as many people as possible.
Claire?
Have you spoke with the community pharmacist teams as well? Because about just having some documentation in the pharmacies for these patients when they visit daily, lots of them. Having some information in the chemist would be really, really beneficial.
I hadn't spoken to them, no.
Okay.
That's a good idea.
I could put you in touch with them. So they like cover all the pharmacies in Hackney, and they're in GP surgeries as well. So it'd be beneficial for at least to have some documentation sent to them so they can give it to the clients.
Yeah, we're gonna start posting on Twitter or X. So even if it's only just for professionals, at least then they can also see it. It's a bit more visual than our website, which unfortunately has no pictures. But we hope to sort of start publicising our locations a bit better going forward. So yeah, but very keen to link with anyone who's willing to advertise it.
Great, thanks, Louis. Does anyone else have any other questions or offers for Louis in terms of collaborating on this work?
Jamie put in the chat, it might be worth if Jamie's able to speak to the comment about the health and wellbeing coach at the greenhouse surgery. Sounds like a really good connection.
Yeah, hi there. So yeah, we have Shoreditch Trust has a health and wellbeing coach that's that's based in Greenhouse, offering support in combination with the clinical teams there to improve people's health. So I think I've dropped Fiona's email address into the chat there. So I would say that would be good to get in touch with her, and if she doesn't already know about the service. I've sent out an email to all Shoreditch Trust staff, but it might be worth contacting her directly.
Fiona, is that?
Yeah, that's right.
Thank you. Thanks very much. And if anyone's just in Hackney Central on a Friday, please do just pop by and say hello as well, because we are just usually outside. Well, even in the Hackney Central Commerces, and then if you're in the Ridley Wood area as well, yeah, please do pop by.
Amazing. Does anyone else have any questions or comments before we wrap up this bit of the meeting? Jenny?
Just to ask you to come back when you can, Louis, and join this group if there's things you want to ask the group, and to help shape the work, or collaborative opportunities that come up. We'd love to keep in touch on all of these areas of work, because it's I think it's a brilliant, and I think we'll reach out to our food network as well, and our community infrastructure organisations, some of whom aren't able to attend this at the time that it's on. So if that's all right with you, because Abby works with our food network, and we have a food network coordinator who I'm sure would be interested in including information about your website and that offer, because of course there's quite a wide food offer in Hackney that would be, I'm sure, really interested in seeing how they could work kind of more effectively with you.
Yeah, that sounds great. And actually, on food, it just reminded me, we're quite keen to link up with some sort of coffee, what's the word? Coffee barista service, because we're trying to I've always feel like for these kind of soup kitchen-y kind of outreachy models, I always get a watery tea and sort of an instant coffee. So we've got a little mini cappuccino machine. We want to try and get some donations so we can just sort of, it humanizes the service more than just what it is normally. So I'm looking for donations of coffee, basically. So if anyone has any links.
Charlie, do you want to come in?
You could try reaching out to Climpsons and Sons, the business, because I know that. So the Tower Project, which is an organisation in Tower Hamlets, which supports people with learning difficulties to be trained to be baristas, and they have a supported cafe in Tower Hamlets. I know that they have a relationship with Climpsons and collect from them directly. It may be that they are open to doing a similar relationship with you. You could try reaching out to the Tower Project to find out how they did that as well. There might be worth it.
What was that? Sorry, Clinton and Sons?
Climpsons and Sons. They're a kind of local organisation.
Thank you.
Nice one, Charlie. Thanks for that. Anyone else before I wrap up and turn off the recording?
Thanks, everyone.
Jenny?
Thanks, Louis. Yeah, I just wanted to mention an email that had come through before we turn off the recording, in case any of our voluntary sector organisations were interested. There's some free training for voluntary sector organisations who are working directly with young people who might be experiencing anxiety through the neighbourhoods team, and we'll include information in the newsletter, but it's quite timely. It's First Steps. It's the First Steps team who's offering training on understanding anxiety for colleagues working in the voluntary and community sector with children and young people. And it was developed in response to the concerns raised at Wells Street Common Neighbourhood Forum earlier this year about the high numbers of young people experiencing anxiety and how to support them. So there's a list of the things that it helps with. It covers safeguarding, preventative strategies, coping strategies, understanding panic. And it's being delivered across all of the neighbourhoods by the end of March 2024. So there is still time to sign up for other ones. So we'll put it in the newsletter. But for anyone who is interested in, who is working with young people and who might have availability next week on Wednesday, the 6th of December, there's a training at the Pedro Club between 1 and 3. And I will put in the chat those details so that you can share those. If you know any, if you're working with any organisations, I haven't got the Eventbrite link. But yeah, if you want to just drop one of us an email, we can forward you the email. That's probably easiest because then it's got all the details. So if you are working, if you're on this call, you're working with children and young people experiencing anxiety and you want some support in thinking about how to manage that, then drop us an email. If you think you might be interested in the training next week, we'll forward you the email. Just put your email in the chat or email John or I or someone else in the team. I think Charles and Hannah put their details in there, but we will include it. Look out for it as well. The trainings are running across all the different neighbourhoods right up until March 2024. It sounds like quite a good offer, and also those trainings are always a good opportunity to meet other local partners delivering services in the area. So just encourage everyone to let people know about that. I'll forward John will include all the details in the newsletter anyway, so I just wanted to make sure that was captured on the recording before we switch it off for anyone else who's great. Thank you. And for those who are listening to the recording, if you want to be involved in much more in-depth discussion with all these brilliant minds on the call, then you're going to need to turn up in person, unfortunately, because we are going to be stopping the recording and opening up discussion so people can turn their cameras on and not have that bit recorded. So just last thing to say. Thanks.
Thanks, Jenny. And I'll include all of that info about the training in the newsletter. I'm going to turn off the recording now, but thanks again, Louis, for coming along. I'm really glad you could make it and hopefully make some connections which will boost the offer of the van. So thanks for coming along, and I'll stop the recording now.